we'll go on with the rest of OCAL's presentation, and then we'll have a dialogue at the end with some of the other comments and questions, Steph, if you don't mind. So we'll go ahead, Eduardo, thanks.
Yeah, we'll be definitely recognizing that there's probably a lot of discussion, so we'll try to get through information as quickly as we can. So this slide was just really meant to provide a bit of considerations from the OCAL lens, but as we know, obviously, that doesn't mean that that's the whole picture, and a lot of the audience might have great insight that are working also very directly with workers themselves, but we really wanted to touch on the fact that we really need to ensure workers understand hazards in their context and are made aware of new risks, insights resulting from procedural changes. So all this information that we've heard, this new understanding about what went wrong, we really need to prioritize on figuring out how to get that right to workers directly. Ideally, obviously, this would be a feedback loop through employers around reorientation and continuous safety communication. But as we know, we also need to go right into community level outreach as well, directly to workers who may not be getting this information. So we also have to support employers and workers to attain a level of two-way safety communication that is needed. So again, it's so clear that during this pandemic time, safety communication is of the utmost importance, and this is two-way safety communication. So it's really critical that we figure out how to really get the standards up on that. Support workers whose concerns are not being addressed at the workplace, so where the IRS is not functioning. And this is really critical because, we hear reports of workers' situations that really, we can't be, letting workers be in dangerous situations without access to guidance and support. And make, the reporting channels that we've talked about, really make them actually accessible increasingly to workers, because if this is really a route where we're being able to flag things going wrong, then we really need to use those tools, or workers really need to have access to those tools to keep using them. And as part of that, really look at anti-reprisal support and continue ensuring that this is effective. And as we all know, there's a lot of work there to make anti-reprisal protections for this population actually work. So in terms of the developing high-functioning intern responsibility, again, it's just kind of really touching on the fact that for compliance, we're really needing it to be, to safety communication really be rooted in understanding, communication, and engagement. Ensuring that this is what's happening on farms, this is the level of safety communication is critical. With understanding, we obviously get buy-in, we have that feedback loop from workers to identify and strengthen policies at the workplace level, figure out what's not working, and clarifying if there's a lack of understanding on anything. So this is key as well, because with what we sometimes see in these emergency situations is potential assertions of safety practices just based on control, potentially from the employer level. Sometimes it's understandable in a situation where you're trying to control all the risk factors. However, if that's really the way that things are happening, it really leaves room for misunderstanding, safety gaps, and risks. If again, one clear example that we're hearing is the worry about workers going off the farm or going into town because of obviously the heightened risk then of exposure from non-farm people or through their travels. So one, what we keep hearing is then sometimes workers being told that they just cannot leave the property, versus a more effective route would be to have conversations about the importance of recreational time, the importance of off work time, but how to do so in a safe way. Language barriers obviously further complicate and challenge IRS and workplace communications. So that's something we need to consider. In terms of kind of how we can support, we've been really trying to figure out just some really practical guidance and tools to really improve IRS functioning on farms and help with safety communication. And in our experience with farms, because we have worked and are invited to present information on farms and we dialogue with farms, farms are at varying levels of capacity, communication capacity and effectiveness. And, you have some doing a great job, both in English and in Spanish in terms of communicating to workers. And then you have some that communication is very minimal in terms of the capacity. So we really need to identify that people are at different places, but we really need to identify where they should all be going and the level that they should all really be able to be reached. And again, at this critical time, right? And then support them to get to that level. In terms of language support, that's crucial, right? Because on farms where you might not have, the experience with safety communication, but you add language, it obviously further complicates. So in the immediate, we really need to look at just identifying any language needs that farms may have and address that through either, professional services that are available, or we're seeing a lot of volunteer initiatives that are popping up of Spanish speakers, Thai speakers, and offering their services directly to farms. But, this really is critical to just get those resources out to farms that need them. But on a longer term basis, we really need to address the sector's language capacity and do so structurally sustained and professionally. These workers have been coming for such a long time, yet the industry, the health and safety industry and kind of the resources around them haven't done a job to really reflect needs around language and comprehension. So one example of a structural kind of capacity building initiative, and I don't just mention it because we helped out, I kind of feel bad to highlight something that we've done, but it really did feel like it was, a step in the right direction around language, but, identifying that the Ontario Pesticide Education Program had a capacity gap to be able to train sprayers in Spanish. We worked with them and they were able to develop their first Spanish-speaking trainer roster. So that was then able to be offered through farms in Ontario and actually provide that, crucial pesticide sprayer training in Spanish as well. And again, so this is just really important to understand that we're hoping that this level of communication is happening on farms, but we also recognize that, in some situations that's not happening. So we really need to, again, focus on listening to workers, worker-led, and advocacy groups that are connected to directly to workers to really make sure that we're hearing what's going on at that level and support any disenfranchised workers and ensure that no one's left in dangerous situations. One, opportunity that we all really need to get a bit more a hold on, and I guess other different agencies are already taking steps towards this, but it's to use social media and information exchange platforms that are accessible and used by workers. So we know that there's, Facebook groups, WhatsApp, communication that's happening. So it really provides a big opportunity to send key information through those channels, and hoping that they're also reaching workers at the workplace level, but to make sure that then we're doing it at both levels. So this just really quickly, early on when this pandemic began, we really felt that there was a lack of COVID-19 resources for the worker education level in accessible formats. So when we were looking at what was being offered at the Ontario level and even at the Canadian level, there was not much. Soon there was the production of some materials by public health units, community health centers, as well as some of the health and safety associations. We put in some work to try to identify as many of these sources as we could, as quickly as we could, both Ontario, Canadian kind of produced sources, and then like what often happens with us is when we can't find the resources that are good from the Canadian level in terms of language and comprehension, we look south to the United States. So we did that. We did a review of key farm worker related and just basic COVID education materials, also from Mexico, government of Mexico as well. And we've put those together in PDF documents, and we distribute these extensively, mostly to the employer groups at first to try to really support orientation and education on the farm. And then we've started to also then prioritize circulating these just through worker channels too. We tried to categorize them by topic, and then there's also videos because again, we're really making sure that these, text heavy, really just translating a really long document is not necessarily the most useful of what we really need. Recently, we've also put together, we've spent some time, and actually for this presentation, this was the initial product that was supposed to come out of it, but this webinar motivated us to complete this. But this is a presentation that we're going to film where we've tried to include some key safety messages for workers, because we are finding that a lot of what everybody's discussing, it gets really into nuanced levels of safety with these communities that a lot of the materials that we're finding are not reflecting, and could also be better presented through audio and video means as well. So just to kind of show a bit of some of these materials, and we're going to actually send out a link to this complete tool to all of you as well, and we're really open to hearing feedback of what's missing, what you think needs to be added before we film, and then this will be translated into Spanish to have an English and Spanish version. But so here we really focus on key safety messages. We really try to find good infographics. So the ones above are from the Canadian Centre for Occupational Health and Safety. The other ones are from the Ontario government, and we've actually translated some of these into Spanish. So again, they really, I won't go into too much detail, and they're very obvious in terms of what they're trying to communicate. But we do go into them in the video a little bit into detail. So for physical distancing, we do talk about how, if workers get to a work task that they feel they can't maintain physical distancing, to stop what they're doing and, talk to the supervisor or employer to problem solve that, right? Because we know that there's continues to be situations where, physical distancing doesn't seem to be clear. We've also really focused on PPE use. So as Denise pointed out, we really wanted to get to the point of clarifying that that's the last line of defense, as well as the risks associated with improper PPE use. And we really focused on ensuring that workers know that their employer should be, providing them information about how to put on, use, and take off, safely remove PPE. We've talked about how it can provide a false level of security, and how there's still a heightened risk of contraction if you, for example, touch your face with gloves or touch your mask while it's on, and then just reviewing the process of putting it on, taking it off as well. Again, really trying to find visuals that can help communicate those. And again, also trying to weave in the IRS into this, saying, if you do feel like you require PPE, discuss this with a supervisor. We also, and it kind of touches a bit on the information that Denise also shared, we also really try to identify high-risk spaces in the bunkhouse. So we really also wanted to mention here that we don't want to confuse information being provided by the health units or by the employers around bunkhouse guidances guidance that's been provided, but we did want to kind of come up with very clear and useful insights that might resonate with workers around their washroom, the kitchen, the bedroom, just to really, increase understanding around the high-risk activities that could take place here, and some practical suggestions to kind of get people thinking and considering. As part of this, we also kind of reiterate that if workers have safety ideas or questions, again, always discuss with coworkers, people that you're sharing space with, to get on the same page, as well as try to engage with supervisor and employers. We also try to tackle some of the more nuanced safety issues as well. So again, we've heard a lot about the physical distancing and safe travel during leisure and off-farm travel. So we really wanted to unpack that a bit, because again, unless there's a public health order of a lockdown in amidst a crisis, leisure time again is an important part of workers' experience to disconnect around supporting their mental health and such. So we wanted to get into that. We have a couple of slides around what to do if you're sick that I won't speak too much of, because my colleague Michelle Tu is gonna follow me to speak a bit more about that, as well as non-emergency healthcare. As we know, during this time and with heavy agricultural work and all the hazards that come with it, there will, hopefully not, but probably will be other health issues, non-COVID related or non-emergency. We do also talk about mental health. We try to really discuss and kind of address stigma around it, and really highlight how COVID has really affected the mental health of a lot of us, and that we can imagine even more so when folks are away from family, you know, doing hard work and such. So we go into that as well, and we actually have compiled some mental health resources, general resources for the province, as well as some resources that are particular in region. But this is definitely an area that, you know, if other people have more information, more useful, you know, contacts, that would be great. A lot of the mental health resources we found require filling out forms. It's, you know, we've struggled to find just direct lines, but we also include some of the volunteer-run conversational support opportunities that have popped up throughout the province as well. So we include some numbers that workers can call to sign up just to chat with somebody as well. And this is, we also then go into really talking about rights and responsibilities, the IRS, but also really situating around worker rights, the right to know, the right to participate, the right to refuse unsafe work. We have a lot of experience in this. We've presented this quite a lot to migrant farm workers in our workshops, both on farms and in the community as part of awareness training workshops, they're called, as well as we presented this to newcomer workers. So we tend to then really talk about, you know, whatever, if you have any question, it's your right to engage. So really trying to promote that. But then it's also recognizing that, and so we also talk about health and safety reps, joint health and safety committees, which is also something in terms of our considerations, is something that we also need to direct support for, you know, the development of, because we know that in many places, migrant workers are not actively participating in those roles or capacity, or in those roles. And we talk about then if concerns are not addressed in the workplace, how to contact the Ministry of Labor. And we talk also about anti-reprisal protections. But again, you know, as part of, it's very difficult to talk to workers or present to workers anti-reprisals when, you know, we continue to really require to do work to make those actually useful for folks. So it's a bit of a challenge there. And it's something that we need to then work behind the scenes to clarify. And then lastly, we've included this phone number, an OCOW number, where we're hoping once this resource gets released, workers can call or text to, and I know that other organizations and community groups and worker groups have similar numbers, but just to kind of get any feedback on any questions around this material or identify any other health and safety information that workers may be interested in and require. So now I'll pass it over to Michelle to continue.
Hi. Okay, whoops. Hello.
We can hear you. Doing
good.
good.
Okay, very good. Thanks, Eduardo. And I'm the last speaker, just for everyone's information. So this won't take long. Eduardo's mentioned some of the material already. But as Eduardo mentioned, OCOW has a clinical role and conducted walk-in style clinics for over a decade and continue to work with community partners regarding workers' health. And the ability for temporary foreign agricultural workers to independently access primary health care has always been a challenge. And that lack of access has been highlighted during the pandemic for sure. As Donald mentioned, workers may be afraid to report symptoms to employers, or in the case where a report's been ignored, this has meant that cases have not been identified in a timely fashion, which may have led to larger outbreaks than necessary. It has also resulted in workers not receiving the treatment that they needed with resultant serious consequences. And we continue to hear concerns from workers about their health. And so the inability to access healthcare independently is in their own language to enable diagnoses of health conditions, including COVID-19, will result in better overall health for workers for sure, as well as an increased productivity. Language and barriers and systemic racism can both affect the quality of care, I think, as many of us know. And there's an increased risk of death for people of color in most countries. And as already talked about a bit, migrant farm workers are away from their families and lacking the kind of social supports that other agricultural workers may have. And income supports during quarantine testing may be less than adequate, and this is a great concern for workers. And the long road to recovery in a small proportion of cases may make return to work very difficult. Next slide, Eduardo. Yeah, thank you. So this is a slide, Eduardo's already talked a bit about it, which is going to be for workers in terms of telling them about what to do if they do feel, if they do have symptoms or are concerned, and what that reporting structure should look like. That's the reporting structure that would be recommended. But in the case of severe symptoms, to identify for the workers that they need medical attention quickly. And we know that there are or were workers who did not know how to contact 911. And we've worked with Ontario EMS to prepare specific instructions for temporary workers, which should be available this week. And also guidance about what to do if their reports of symptoms to their supervisors have been ignored or not acted upon. And we've certainly heard this in some workers' scenarios. And if they had access independently to healthcare services, that would be a route that they may be comfortable to connect with. The next slide there. And Eduardo, yeah, thanks. And so Eduardo mentioned previously in terms of the fact that there are non-COVID healthcare issues that present to workers quite often, things like shoulder strain, blood pressure issues, needs for medication, etc. And so there are a number of health clinics in Ontario that offer non-emergency health services specifically for international workers. And the links that they provide in terms of how to access them do so through channels that oftentimes workers use that the rest of us don't. But it's also what's really important is that these clinics, through their understanding of the challenges and needs of this population, that they are able to facilitate care with translation and anticipate needs and provide information in a format and language that workers can access and understand. And you know, many of them have made videos and are doing Zoom consultations in some workplaces. And so they're an amazing resource, and we're going to provide a link on our website for that. The next slide. So this is just an example of some of the areas. So just the next slide, Eduardo, too, and just move on. There we go. So a couple of questions have already come up about income continuity to COVID during COVID-19. And this is a huge concern and question for workers because they are depending on income to send home to their families, as well as to support them while they're here, but mainly to send home to their families. And so likely if they don't have reassurance about income continuity, that it probably interferes with reporting of symptoms and conditions. So it's very serious. And so in terms of income continuity, as already mentioned, WSIB is available, and workers who are diagnosed with COVID-19 due to a workplace exposure are eligible for WSIB compensation. Unfortunately, according to WSIB information very recently, workers who have COVID-19 but no symptoms, they may be eligible for WSIB, but that's decided on a case-by-case basis. We don't have the presumptive legislation that they have in BC where this would naturally occur. But in both cases, the employer needs to report this to WSIB, and then the chain of events after that is that WSIB will connect with the workers to complete Form 6 or the worker report. And WSIB has a lot of staff that is actually allocated to this. They're working with a modified Form 6, and they have quite a number of Spanish-speaking staff that are assisting workers to complete Form 6s. But they aren't being reported in every case. And so it is important to get the information out to workers and advocates that workers are eligible for this and to assist them with filing claims or initiating claims by a Form 6 or medical report. Other income replacement, workers who are exposed to someone with COVID-19 in isolation, WSIB at this point in time says that they are not being covered. However, on the next slide, it says that they should report that. But they also should be eligible for benefits through at least 2 other sources, which is the private carrier through Cowan and EI sick benefits. Maybe just flip to the next slide. So this is the slide that WSIB uses in their presentations around COVID-19 and reporting. And as you note, it says if your employer tells you that they believe that they've contracted it, or you believe there was a potential workplace exposure, that the employer is supposed to report that to WSIB. I did send an email to try and confirm whether that's an or an and in terms of those 2 points. But as already been mentioned, that in the WSIB stats page, that there are 353 claims in play, so it seems, and that I think that we're fairly confident to say that there are over 500 cases of COVID-19 amongst migrant farm workers. And remember that the stats reported by WSIB are all agricultural workers and not just migrant farm workers. And so I'm going to turn it over to Val for questions.
Great, thank you very much, Michelle and Eduardo, and also Ron and Denise for your presentations, and Donald, who are all still here. I think it was only Vince who had to leave. A lot of material. We squeaked it in our 90 minutes, but I know that people may want to ask questions of the speakers. There's only one other comment in the chat box right now that talks about reprisals, and that there's a number to call for a worker who's reprised against. But upon calling the hotline, what protections / services are workers provided after contacting the ministry, and how can they be guaranteed employment in subsequent years, which is a big question given the paradigm of their work, especially the Temporary Foreign Agricultural Worker Program. So I guess that's a question for Ron. But I don't know if anyone else has any other.
Sure. I can start off on it, and anyone else can weigh in if they like. So if we have a complaint of reprisal, for example, if someone called in and said, I raised a concern about ladder use, for example, and I was reprised against for one reason or another. So the Ministry of Labour, Training and Skills Development, we would investigate that claim as far as the health and safety concern is considered. So, for example, if it had to do with ladder use, and we go to the workplace and we do an investigation on ladder use, make sure that everything's being done properly, and if there are contraventions of the Act or the regulations, write orders to correct that. Whether or not the individual was actually reprised against is not a decision made by the inspector. That is referred to the Ontario Labour Relations Board, and they would make they would do an investigation and make a decision as to whether or not you were reprised against. And if the Labour Relations Board determines that you were reprised against, they can order remediation, everything from being rehired to financial compensation to, whatever remedy they feel is appropriate in the circumstance. That's their piece of it. But the Ministry of Labour, Training and Skills Development looks strictly at what is any of the health and safety matters around that.
Did someone else? So here's a question, Michelle, can you speak further about the designated clinics for foreign agricultural workers that help address non-emergency care, also hospitals seeing foreign agricultural workers in case they have a non-COVID related injury, illness, and has any part of that process changed now?
Yeah, that's a good question. Much of the assessment work by many clinics, primary care clinics, et cetera, is being done virtually. And this is the same with the clinics or the CHCs who have designated services for migrant workers. But they are very active, and they're seeing a lot of workers and hearing from many workers about some of it about COVID related conditions, but also about other conditions. I think the same thing can be said for emergency rooms. And many of the messages that you hear from healthcare workers and the Heart and Stroke Foundation, et cetera, is to not be afraid to go to emergency rooms if you have a serious condition, because they are being obviously very careful about protecting everybody's safety, and that if it is even on the virtual assessment with the worker, if it's deemed necessary that the worker should have an in-person assessment, that is arranged and that is being done.
Great. Thanks, Michelle. That's helpful. And I actually put the link for our temporary foreign agricultural worker and COVID-19 safety considerations page there, because we have posted the chart of the various ways to get help in all the different regions that you recently compiled. We put it up this morning. Anybody else have any questions that you can type in, or it would be possible now for individuals to unmute themselves and ask a question directly if they want to. I guess we have questions for you in terms of we were trying to share a lot of what we're thinking around some education modules, but still done with sort of slides and information. As everyone appreciates, there's a lot of sort of different aspects to prevention. Wondering if anyone has any feedback even on what you think the key challenges are, and or what information is not understood, or what more can we do, I guess. Any input or insights?
I have a quick question about language. I know that language, I think Eduardo mentioned language is a long-term, something long-term that we're looking at to ensure that that these workers understand and they're properly educated about all these processes and the health and safety piece. Are all of the orientation sessions with regards to health and safety for foreign agricultural workers, do they always require an interpreter or translator to be present so that there's a clear understanding of what's being communicated in terms of education and guidance and best practices?
Yeah, I guess we can frame that. Can you hear me? I think I was muted before. Okay. I was going to say maybe that kind of as two pieces, because that could go to Ron. We initially had been asking about that as well, in terms of when an inspector would go to a workplace to kind of assess that everything's going on. We know that now there's, the need to show that, orientation or training has been provided, but we wanted to really understand whether that's being verified that it has been provided in the language of workers. And I think the ministry had said that that would be the case, but I don't know if, Ron, if you have any clarity on that.
Always many times with farming and agricultural field visits, there's a language barrier component to it. So some of our inspectors have their, have second and third languages that assist in that matter. But we also have translation services available to our inspectors should they feel it's necessary during a particular inspection. I know myself, I started as an inspector in the industrial program, which also looks after farming and agriculture. And, I personally have done investigations where I've had translators come with me to help ensure that level of knowledge at the worker level to ensure that the workers are actually understanding it in cases where they can't speak English.
Well, but in terms of when the inspector does kind of identify what has been done by the employer, I mean, in terms of orientation to the workers, does the MOL inspector verify that the orientation that was done by the employers was done in the language of the workers?
Well, you have to be able, yeah, you want to make sure that one of the questions I'll ask is what are the languages in the workplace, and how do you reach out to those individuals? So that is part of it. The challenge is if you want to actually drill it down to the worker level, actually speak to a worker to ensure that they got all that knowledge that the employer is saying they delivered. You want to ensure that, you know, if you wanted to ensure that they actually absorbed it, learned it, and remember it, that can be a challenge if they don't speak English. So that's where translation services may come in.
Yeah.
So there's another question from the County of Essex. Actually, has the Ministry of Labour used other locations to educate migrant workers besides the workplace, such as migrant worker centers, service clubs, and churches? It's community organizations which we work with a lot because they do support workers in the areas. I guess, has the ministry ever thought of engaging with
yeah, so we have obviously a ton of information available on our website and various social media avenues that we use to try and get information out there. Christy Eve, our provincial specialist, she goes to a lot of these community events and fairs, things of that nature, where we know that workers are present, work fairs, to spread the information and hand out documentation that we've translated into various languages to provide those resources directly to the workers.
Okay, thanks. Yeah, Eduardo, did you want to talk anything further about some of our community presentations that we've done in the past, or some of the community networking?
Sure, I guess, yeah. We've often, tried to hit those community levels as well. Recognizing again, as we touched on, to make sure information just getting to workers at whatever level, as we then work focusing resources to the employers to have that as well. I did also want to kind of circle back just really quickly to Stephanie's question about reprisals, just because I do think that that's something that's so key to this in terms of, again, ensuring that workers understand their rights, but also understand the process that would actually then protect them to assert those rights. So I understand that, yeah, if there's value in the MOL, in a report for a reprisal to trigger, from a health and safety perspective, looking at what could be the issue, because then, hopefully that issue's clarified. But in terms of then, we might really need to prioritize looking at the Labor Relations Board and really looking at stats or trying to identify. And I know a lot of the worker groups probably have workers who've, troubleshot these systems. And so we really need to maybe pull from those experiences at what that has looked like for workers dealing with the Labor Relations Board. Because in our opinion, we have done a lot of work even getting workers to become familiar with the MOL's contact center calling. And so I know Christy has done a lot of work to let us know what that process would look like, to identify what it takes for a worker to even get through the automated English part to then get to somebody where they can then ask for a translator. So we've kind of pushed a lot to have workers understand the process, because what we find is that if a worker doesn't really understand, or it's not even understand, it can't picture what it's going to take, what their experience is going to look like as they, report or appeal to something, there's less confidence to do so, right? So if we can really clarify what, if the Labor Relations Board route, what that looks like, and really be able to articulate that to workers, I think that's, is really a really needed priority, and make sure that it works, right? And I could see from a lot of experiences from some of the advocates probably have a lot of experience with that. I don't know if anybody has comments on that or experiences with workers on that.
I guess not. Great. I don't see.
Oh, can you hear me, Val?
Yes.
It would help if I moved my mic down. Hello, everyone. And so we just found out here in Windsor, Essex, that we are the last part of the province to still be in phase 1. And the mayor's upset, all kinds of people are upset. And I guess, so I have a couple of questions. One, for the session that you just had with employers, was Windsor Essex County represented? Does, what needs to happen there? Because the assessment clinic in Windsor Essex was very underutilized last week, and seems to be a combination of some workers, rightly so, being fearful of being tested for the reasons you talked about before, but maybe some reluctance on the part of some employers. Do you have any comments about that? Where should we be putting our efforts here in Windsor, Essex?
Good question, Catherine.
Yeah.
Like, I guess Ron, I don't know if, or I guess Vince is gone. He's the person from that area, from the ministry office there.
But also, I believe they mentioned mobile units going to farms now. So that's what was
Yeah,
mentioned at the
Tanya.
conference. So
Yeah.
I think that's the next step. So, because that's what they started doing before they opened the testing center. There were, the Leamington Hospital line was going to some farms, and then they opened this big center, and that was a fiasco. And I want to know why it was a fiasco, because Kathy, you mentioned a few reasons, but I want to know, whether we have any feedback from the workers as to why they were not going, whether they were expected to go during their workday, in which case, would they have been paid for the time that they would have taken off to go? And if not, if they were expected to go in the evening, then, they get home late and they're exhausted and need to cook and shower and rest a bit before going to work. So you can't blame them for not wanting to spend the time to go to the center. But the other thing, some of them may have been afraid to actually contract the virus by going to the testing center and being exposed to others. Then there's also question of transportation, if they're all on the same bus and they're not protected, that's another fear. So I'm wondering, whether anyone knows why they were not going and how these things can be addressed. So I think a mobile unit is probably a better solution. Well, it is a much better solution. So hopefully we'll have better results from that.
I think, Catherine, both you and Tanya raised the question: what next? There's been, as you say, in Windsor Essex, there's actually been a lot of community cooperation, and I have to say, as a clinician, I was so happy to see that response team that was checking on the workers who were in isolation, because it was not clear who was actually checking up on them. And it varies from location to location who exactly is caring for these sick workers. And at this stage of the game, there's a bunch of opportunities in play, and I understand the Ministry of Health is collaborating with OMAFRA about looking at repeating the Windsor model in other areas. But I think that you're saying that the Windsor model isn't working. And so there are so many people who have a piece of the solution of this, that this discussion seems like it needs to go beyond the people who are having a discussion. Because Tanya, you raised a lot of really valuable points in terms of why aren't workers going there? for testing. To be honest, I haven't had the test myself, but I know people who have would not want to have it repeated again. So the idea of having repeat testing every couple of weeks, I can see that people may balk at that. But I think the answer to your question is beyond perhaps the walls of the people who are having the discussions.
Yeah, I agree, Michelle. I mean, there has been a lot of community cooperation here, but it seemed to take, I think because of who's responsible for what, I mean, it was it was wonderful that finally a response team went to check on workers, but that was after both deaths here, at least one of them. And again, it's difficult to know where to start.
Thank you both, Catherine and Tanya. And I think we do welcome more dialogue on that, but it's very complex, and it's very, you know, reconciling what is appears a mild illness in many people with the severity that can arise in people of all ages, particularly those with any underlying health conditions or comorbidities. It's so it's that we have to treat it as a serious risk, even if it's presenting mildly. I think has been kind of the conundrum, and some of in many sectors, not just the agricultural sector, are kind of slow to catch up to the level of severity. On the other hand, also trying to, it's a whole new world to try and not just run a farm in a time sensitive place or sector, but now with all this guidance from so many different levels and so many different issues to consider, it's quite challenging. There is a question that Leah left. She wanted to ask, I think this is a question for Ron again, around under what act or legislation are the field visits taking place? So is it clearly the OHSA, but is ESA involved at all in what you're looking at when you visit the farms as part of the initiative?
So the initiative that we're currently underway on is our health and safety inspectors enforcing the Occupational Health and Safety Act and its associated regulations. There really isn't an employment standards component per se, unless they become aware of something, then we would flag our inspectors on the employment standards sides to look into those.
Okay, so kind of keep an ear out, but it's not the intent. There's a question from someone about accessing employer resources from the earlier session, which we can put you in touch with the host of that, and also employer resources that our organization would be able to. And WSPS, of course, has recently updated their content, which we could look for that link and paste in here. But also we will be following up with everyone who registered on Eventbrite. We will post the video version or the recorded version of this session, as well as the Ministry of Labor one, sort of separated out so it can be more accessible to workers or employers if they're interested. And we will share our deck and the way we're considering to break it up in terms of bite-sized pieces as a playlist on YouTube or a similar site. But we will share that to ask for feedback from all of you in terms of what more or what less. Maybe it's that's the struggle with so many complexities, not to drown people in information. So we look forward to your continued engagement, and it is a session that we're developing for workers in video format, hoping that is more accessible than endless words. So I think that's probably enough for today, although we can stay on until 4 o'clock. That's another 10 minutes. If anybody else has anything they want to share dialogue about. But I think that we don't have any more questions right now. And I recognize that people are busy and that there's a lot of lot of work needing to be done on many different levels. So. Oh, and thank you, Michelle, noting, yes, that they have, that they will host the deck, and the presentation from the noon hour session will be on the Ontario Fruit and Vegetable Growers Association. I think they sent a link to it already to people who are registered. And it was an initial baby step in doing parallel presentations at the on the same day that were circulated jointly. So we're hoping to build more bridges, and so that we can prevent this disease and other occupational health issues on farms for everyone going into the future.